We have to also keep in mind that whenever we talk about biologics, at this time, we're talking about biologic in addition to oral immunotherapy. So we haven't really done biologic monotherapy yet. I mean, there are studies underway, but we're not subjecting a patient to just biologic without the oral immunotherapy on board as well.
Do we imagine there's going to be this equally good benefit, or is there going to be?
I think that the reason for that is we're hoping not to subject the patient to a biologic long term. I mean, when do you stop? So at least for the Xolair studies, we only have them the first 16 weeks of their kind of updosing protocol, and then you back off. So there, you have, I mean, for the newer studies where the age is 2 years and up, you're not subjecting a child to a long time of biologics. So with monotherapy, because they're not actually developing actual kind of interaction with the food, they may not be protected unless they take on the OIT, or if they stop the biologic, they're going to go right back to being reactive, which is part of the reason I think oral immunotherapy with biologic makes sense. That being said, we see so many kids who are just so severe that they cannot use oral immunotherapy at all. And a biologic could be a great way to at least get them started, monotherapy, and then when they get to a spot where they are able to consume, they can kind of bridge into the oral immunotherapy at that time. Or maybe use it as an as-needed basis, like they're traveling and you get a dose of a biologic a few weeks before going, and you're protected for a certain amount of time. Just because we come across so many children and teenagers who are just like, I'm just going to avoid it. I don't need to eat the food. I don't want to get shots. I don't want to do OIT. I just don't want any aspect of it. Whereas their parents are like, but you need to be protected. And a lot of times, a lot of my patients who are very under control in the United States, they travel. Maybe they go to Asia, they go to Europe. I mean, it's a lot easier in Europe now than it was before, I suppose. But it's just a lot harder to be on top of your food intake if you're not actively cooking every ingredient yourself. So some sort of biologic to kind of block that immune response for a short period of time, I think would be a great way to use it for a subset of patients.